we live in a very sex negative country. A lot of our communities, if they talk about sex at all, it is very negative and stigmatizing and shame-based. The reality is we have adults, all of us are walking around with all the shame and stigma we have been told and absorbed through our whole lifetime, and it is like very hard to talk about things. And maybe we don't even have the facts in the first place, or we did 20 years ago, but the fact has changed. When young people get good sex ed, that is awesome. If they go home or to like other community members that are super stigmatizing, that undoes some of the prevention work that educators did in the classroom, and that can be really challenging for people. So like coming at it from all sides and all angles is great. And also, like, I would love for people to talk about sex all the time, normalize it for the joy of it, and also for the prevention aspects so that they can talk openly when something makes them uncomfortable. Our providers in our healthcare system in Planned Parenthood talk about sex all day long. All they do is talk about sexual health care, right? And so when people are coming into the space seeking healthcare, oftentimes it isn't just, I need the STI test. Oftentimes they're coming in with a lot of trauma and stigmatizing language, and they need non-judgmental care. They need someone to affirm who they are when they walk in and let them know that they deserve medically accurate, affirming, inclusive sexual health. Part of prevention is we need to help people heal along the way who have experienced trauma and get information out there. If we're supporting someone who's in crisis, it's really easy for us to talk about housing, and that's great. Food, great. Clothing, great. Do we talk about sexual health care the same way we talk about housing, right? We usually don't. We don't because we're uncomfortable. And then you add if someone has had any sort of sexual trauma, and then we don't want to talk about sexual health care. But the reality is that people still need sexual health care and also need to be encouraged to connect to their sexual selves in positive ways. Recovering from trauma is great, and it shouldn't be the end point. When we're responding to people who have experienced trauma, and when we help them heal, they're pushing those healing messages hopefully out to the community. Parents who are experiencing violence and go in and have all the shame and stigma around sex and sexuality, the more they learn about their own body, the more they can hopefully raise their children to be able to talk about these things, right? Model to their kids that you can talk about things. It can be a more open conversation. And I just think that helps the community at large.